overturn the FDA's approval of mifepristone, the first of two drugs used in a medication abortion. On Friday, Vice President Kamala Harris held a meeting on reproductive health care access. Listen to this.
But there are now partisan and political attacks attempting to question the legitimacy of a group of scientists and doctors who have studied the significance of this drug. There is now an attempt by politicians to remove it from the ability of doctors to prescribe and the ability of people to receive. This is not just an attack on women's fundamental freedoms. It is an attack on the very foundation of our public health system.
So the Vice President went on to say that the President is committed to protecting every woman's right to make decisions about her own body. Harris did not publicly lay out how the administration, though, plans to respond. Joining us now is Rachel O'Leary Carmona. She is the Executive Director of the Women's March. Rachel, thank you for joining us on this. If, in fact, this medication is banned, what is that going to mean for women?
I mean, it would be catastrophic for women all across the country, and particularly the women who are already most impacted by the insufficient access to abortion care and reproductive health care in communities across the country, communities of color, poor communities, rural communities.
I tell you, I was in an abortion clinic in New Mexico less than a year ago. I traveled with 20 or so women from Texas to New Mexico to seek out abortions at the time. The majority of these women, they were black and brown women. The majority of them took mifepristone as their medical abortion drug. I watched one woman actually take it. And so when you think about the women, as you talk about, that are going to be affected, what other options will they then have?
Well, there is a protocol that doesn't require mifepristone, but it's less effective, and it's less effective at managing pain, and it's less effective at terminating pregnancies, which is, what's kind of at the central core here is that, there are a lot of reasons to terminate a pregnancy, both the decision about when and how to have a family, but also in instances of the mother's health, or as one of our staffers testified to when we did an action in Amarillo last week, in the case of miscarriages. And so this is really, as Vice President Harris said, a strike at our fundamental public health structure, not just at women.
So then the question is, what can be done if this happens?
Well, I think that people power needs to be exerted here, and so we have to be in the streets and we have to make our voices heard. We know that this is a result of a compromised judiciary, one where President Trump put activists on the bench all up and down in federal courts like the one in Amarillo, but certainly also in the Supreme Court. And so I think that we have to have our eye on both instances. This is an attack on women, it's an attack on our bodies, but it's also an attack on democracy itself, and we cannot unlink the two. We have to be careful about both. We have to build people power and electoral power to make sure that we win and beat back these attacks on our democracy.
When you talk about the health of vulnerable women, I just got to read this for folks because it is astounding. The Commonwealth Fund, which is an independent research organization focused on health policy, released this report finding that states with more abortion restrictions have higher maternal and infant mortality rates. What do you make of this, Rachel?
Mm-hmm. I mean, I think that tracks. We already know that maternal health, maternal mortality tracks very consistently along racial demographics. We know that Black maternal mortality is in a crisis in this country and has been for a long time. We know that wealth and whiteness is a determiner of if you're going to have a healthy pregnancy, right, and what your chances are to, have a crisis dealt with when you're having a child. So I think that, and I also think that there are other instances involved. As a former domestic worker, our ability to take time off, to work away from harsh chemicals, to have the kind of health care that you need. All of these things are inextricably linked, and that's why we cannot separate race from class, from economic justice, and from, protecting our democracy when we talk about protecting abortion rights.
By the way, that number is 62%. Maternal death rates 62% higher than they were in states where abortion was more easily accessible. Rachel O'Leary Carmona, thank you so much. We appreciate it. Coming up, everybody, gripping voicemails from Ukraine. How one woman's harrowing messages to Today.com reporter Danielle Campamore kept her connected to survivors of the war.
Last night I heard aircraft so close that I was really scared. That